President Joe Biden addressed the issue as a health concern and expand resources to combat it, particularly among military veterans. My administration is committed to treating suicide as a public health problem it is and helping to address the underlying risk factors for suicide, Biden said in a statement ahead of World Suicide Prevention Day, observed annually on September 10. For example, we are working to expand access to mental health and substance use treatment. We are ensuring health insurance plans act in accordance with the Paul Wellstone and P. Domenici Mental Health Parity and Addiction Equity Act of 2008 and cover these critical services at the same level as physical health services. In 2019, suicide marked as the 10th leading cause of death in the United States and the second leading cause for people between ages 10 and 34. And that was before COVID-19 pandemic compounded. For many, feelings of isolation, exhaustion, and economic and public health-related anxieties. Increased rates of depression have sparked concern for rising suicide rates. While there is no one cause of suicide, we know there are many factors that increase a person's risk for suicide, including the loss of a job, serious illness, and financial, criminal, legal, and relationship problems, Biden said. The president, who has said he considered suicide after his wife and daughter were killed in a car crash in 1972, added he's made veteran suicide prevention a top priority. Biden signed the Sergeant Ketchum Rural Veterans Mental Health Act of 2021, which provides additional mental health care for rural veterans. Biden requested $598 million to support the Department of Veterans Affairs suicide prevention outreach efforts in his budget. He also proposed $180 million to fund suicide prevention programs at the Department of Health and Human Services Substance Abuse and Mental Health Services Administration. This dedicated funding will support programming that focuses on suicide prevention at every age and stage of a person's life, as well as prevention and intervention programs through health systems, he said. Knowing our nation's youth have been especially vulnerable to the mental health impacts of the COVID-19 pandemic. The American Rescue Plan 1 signed into law also includes $20 million in funding specifically for youth suicide prevention. Biden noted that the American Rescue Plan provided the third round of economic impact payments, established a homeowner assistance fund, and provided emergency rental assistance. He said his administration also has committed to addressing suicide by firearm, which statistics show are responsible for over half of all suicide deaths in the United States. That is one of the reasons the White House published model red flag laws for states, allowing family members and law enforcement to petition for temporary firearms ban for individuals who present a danger to themselves or others, the president added. When people present a danger to themselves or others, we must reduce their access to lethal means and ensure they have access to mental health services and supports, he said. Today, on World Suicide Prevention Day, we remember those whom we lost to suicide, and we reconfirm our support for the millions of Americans who struggle with thoughts of suicide, who are suicide attempt survivors, suicide loss survivors, and those who are working steadfastly to prevent suicide. By expanding the crisis line and investing in our nation's crisis care infrastructure, we have the opportunity to prevent suicides and save lives, he said. President Joe Biden exaggerated both the scope of the problem's veteran suicide and his own administration's success at reducing the totals during the State of the Union address to Congress on Tuesday evening. The misleading comments came as the Commander-in-Chief pledged to bolster mental health services and financial support for veterans as part of a broader agenda of improving support services for all Americans. After noting improvements made last year on improving benefits for veterans dealing with military toxic exposure injuries, Biden singled out Veterans Affairs Secretary Dennis McDonough during his speech and praised him for work thus far to help prevent veterans facing mental health crisis. "We were losing up to 25 veterans a day on suicide," Biden said. "Now we're losing 17 a day to the silent scourge of suicide, more than all the people being killed in the wars." But those statistics don't match annual reports from the Department of Veterans Affairs, which show a 20-year high of about 19 veteran suicides a day in 2018, 6,796 veteran suicides nationwide. The most recent statistics from 2020 put that figure at just under 17 a day, 6,146 total deaths. That total occurred during President Donald Trump's last year in office because of a 2-year lag time in compiling census data on suicides. The impact of any policies from the Biden administration is still unknown. Data on veteran suicide rates in 2021 is expected to be released later this year. In the early 2010s, before reliable census data was made public annually by federal researchers, veterans advocates frequently cited the veteran suicide statistic of 22 a day based off partial estimates of deaths from a small number of states. But in recent years, VA officials have frequently sought to correct that figure to more accurately reflect the reality of the problem and better target efforts to provide solutions. Since 2001, the number of veteran suicides have fluctuated between 16 and 19 a day, according to VA statistics. When active duty troops and reservists are factored in, the total is about 20 a day. Last fall, officials from America's Warrior Partnership released a report suggesting the veteran suicide rate may be more than 40 a day, once drug overdoses and other unclassified deaths are factored in. However, VA officials have publicly pushed back against those estimates, calling the higher figures out of step with normal data collection practices. Officials from the White House and VA declined to comment on the president's errors in the State of the Union speech. Biden said he was committed to pulling the number of suicides down further in the coming years, to include expanding mental health screenings, proven programs that recruit veterans to help other veterans understand what they're going through and get them the help they need to recover. "We've got to do more," he added. Despite the incorrect figures, Biden received praise from a number of lawmakers and outside advocates for including the issue of veteran suicide in the national speech. Details of new VA support programs for individuals facing mental health and financial emergencies are expected to be unveiled with the president's fiscal 2024 budget plan due out early next month. The Biden-Harris administration is highlighting key actions it has advanced across the federal government to improve suicide prevention. Suicide is a complex problem with no single cause and no single solution, but the administration is committed to taking aggressive actions, including tackling the mental health crisis. President Biden named tackling the mental health crisis a key pillar of his unity agenda, laying out a strategy to transform how mental health is understood, perceived, accessed, treated, and integrated in and out of healthcare settings. Released in March, the president's strategy outlined several actions to: number 1, strengthen system capacity; number 2, connect more Americans to care; and number 3, create healthy environments to strengthen mental health. Ensuring a robust crisis services infrastructure is a key focus area being pursued under this strategy. Launching 988 as the new National Suicide and Crisis Lifeline, ensuring timely access to crisis prevention saves lives. In July, the Department of Health and Human Services, HHS, and the Department of Veterans Affairs, VA, successfully transitioned to the new easy-to-remember number 988, making it easier for individuals in crisis to access life-saving crisis counseling. The Biden administration has invested $432 million, an 18-fold increase in federal support to help states prepare for transition, providing critical resources to help ensure access to trained crisis counselors via phone, chat, and text. Improving suicide screening and risk detection. Identifying individuals at risk and connecting them to care is essential for preventing suicide. In January, the Health Services and Services Administration, or HRSA, Bright Futures program updated its national guidelines to include universal screening for suicide risk for youth ages 12 to 21 years. With this update, most private health plans will be required to cover this screening at no cost to patients. Also, in January, the Department of Homeland Security, or DHS, implemented the DHS Columbia Protocol mobile app to help identify those at elevated risk for suicide and direct them to support and care. Supporting populations at high risk. Several populations are at high risk for suicide, including American Indians, Alaska Native youth, LGBTQI+ youth, rural men, military veterans, law enforcement officials, and health professionals. In November, the White House released a comprehensive cross-sector public health strategy to reduce military and veteran suicide. This strategy identified 5 priority goals for harnessing a whole-of-government approach to prevent suicide in the military and veteran community. In January, HRSA awarded $103 million in resiliency awards to help promote mental well-being and reduce suicide occurrences among health professionals. In May, HRSA launched the National Maternal Mental Health Hotline, a free, confidential 24/7 resource for pregnant and postpartum individuals facing mental health challenges. HRSA also is supporting Rural Health Information Hub response to farmer mental health and suicide prevention, focusing on programs to address mental health concerns, stress, and suicide rates among farmers and ranchers. In April, the Indian Health Service awarded $10 million for Zero Suicide Initiative grants to 6 tribes and 2 urban Indian organizations to improve the system of care for those at risk for suicide by implementing a comprehensive, culturally informed, multi-setting approach to suicide prevention in Indian health systems. Preventing youth suicide. SAMHSA announced $7.3 million in cooperative agreements for the Gareth Lee Smith, or GLS, State Tribal Youth Suicide Prevention and Early Intervention Program to support youth suicide prevention and early intervention strategies in schools, institutions of higher education, juvenile justice systems, substance use and mental health programs, foster care systems, and other child and youth serving organizations. SAMSHA also announced $2.2 million for the GLS Campus Suicide Prevention Grant Program to support a comprehensive public health and evidence-based approach that enhances mental health services for all college students, including those at risk for suicide, depression, serious mental illness, serious emotional disturbances, and/or substance use disorders. Increasing access to effective health care. Decreasing barriers to affordable, high-quality mental health is a known effective suicide prevention strategy. To help veterans in need get connected to the care or other support services, VA launched the Don't Wait, Reach Out campaign. In March, the Deputy Secretary of Defense issued a message to all defense personnel, including service members, reminding them to prioritize their mental health. The memo assured personnel that seeking professional mental health care would not jeopardize their security clearances and encouraged all leaders to promote help seeking. In addition, HRSA funds Pediatric Mental Health Care Access, or PMHCA, grant program to increase access to pediatric mental health care by building workforce capacity.